Hi everyone, I'm Dr. Katie Morris. I'm one of the veterinarians here at Hamburg Village Vet. I'm also Fear Free certified. And if most of you don't know what that is or not familiar with Fear Free, it's additional training and certification in low stress handling and kind of maximizing the emotional health of our pets. So we are going to cover the cat physical exam today. For a long time, we know cats can be quite stressed when they come to the vet. So we really want to start even from home on minimizing the amount of stress a cat has when they come to the vet. So starting at home, you want to leave the carrier out, let there be time for your cat to acclimate to the carrier. Use things like Feliway, which is a synthetic pheromone, which helps decrease stress in our cats. We have a Feliway towel right here that we're using already to help Jane while in the hospital, but using it at home before you even leave the house has a big benefit. Drive slow, take your time, give yourself ample time. If you come to the hospital and you notice the waiting room is quite hectic, there's barking dogs, just ask one of the receptionists to load you into a room right away so that your kitty cat doesn't become even more stressed sitting out in the waiting room. So here we are at our physical exam. We're going to go through a couple of things. The physical exam itself, an injection, but also maybe a blood draw as well. Jane is 10 years old, so as pets age, it's more and more important to really get a good physical exam. A physical exam is important no matter what age, but as pets age, we really want to make sure we can do things like a good oral exam, listen to their heart and lungs, feel their belly, make sure we're not finding things that can come up over time. A fearful pet can be kind of contracted, they might be trying to escape. It really limits the amount of medical care we can provide. So we know as humans, mental and emotional health plays a direct impact on our physical health. And we're finally now accepting that into our veterinary world. It's so important. I can do a much better job with Jane today if she's under low stress situation. Plus, if she has a good experience here at Village Vet, she will be more likely to be happy to come here on all future vet visits. Thus, we can provide her with awesome vet care. Okay, so physical exam, a couple things to think of. So some terms in Fear Free, considered approach is basically thinking like you are the patient. What would you like? We want to have Jane come in smoothly like we talked about. When we get to the room, have her explore, open the carrier door, let her come out on her own terms. Or even, they may not come out, we might have to use food, but if we go right in and pull her out of the carrier and get things going right away, she might become stressed. So let's let her acclimate to the room, which we've already done. And then I'll start using gentle touch. So gentle touch, instead of constantly doing this, and then I do this, and then I do this, she'll become more and more stressed if I always keep touching her and then not touching her. What I'm gonna do is once I make a decision to start contact, I'm going to maintain contact on Jane and she'll be much more comfortable. She's purring right now, she's quite happy, and so then I'll start my physical exam. In an interest of time, I probably won't go through a full physical exam, but just checking a few things that normally would make Jane maybe stress, looking at her mouth, so you can see she's getting a little tense there. But if we minimize stress, we're more likely to do a really good physical exam. I'm going to feel her belly a little bit. Good. She's doing great. So one thing we want to do also as we progress, so she didn't like that oral exam very well, so let's offer her some treats. Oh, there we go. And during the physical exam, what we might do is find some food that she really likes. We have a bunch of options here. She doesn't have to have it all, but once we find something that she really, really likes, we want to utilize that if we find something during the whole physical exam or whatever we're doing that is stressful to her. So now that's preoccupied her, so let's say I need to take a temperature or I need to do something that might stress her out more. I do have an injection to give Jane. Those are times when you want to use these high food reward items. So if we offer some baby food, that might be even better to her. Let's see. Here, Jane. And maybe she likes the treats. No? Okay. So Sam will offer her more treats, and then that way I can do more things, and I'm going to progress to giving her injection. So this could be any injection. This could be a vaccine. So again, gentle touch, and for the video's sake, unfortunately I had to go back and forth, but typically in a physical exam I would be touching the entire time, dog or cat, and then I'm going to kind of progress a little bit. I'm going to do a little bit more of a noxious stimuli to her. As long as she's still eating, she's happy. And then again, I'm leaving a hand on Jane. I have my injection ready. I'm pinching. She still loves those treats. Pinch, pinch. We're gonna poke. Perfect. That's exactly what we want to have. She has minimal idea what just happened, and she's happy. So she's more likely, when she comes for future vet visits, to have no fear, because she just has no idea that we even did something that may harm her or be uncomfortable for her. Okay, so now we're gonna move to low stress restraint for like a blood draw. So many years we've used kind of the scruff, you probably have heard of. We want to try to avoid that, because although it works very effectively for the person restraining the pet, it can be quite stressful for the cat. So we're going to do, Sam's going to roll her up in what's called a Pareto. So this is basically a way to swaddle Jane so she's not able to run away, but she's safely restrained. Beautiful. And instead of scruffing Jane, Sam's gonna actually kind of scruff the towel. And then what we'll do is gently rock. We're gonna get some of her treats back. So as long as your dog or your cat is still eating during a procedure, they're fairly comfortable. So again, we have her treats. She's a little bit uncomfortable now, but that's okay. We're just gonna go slow. And as long as she's sort of on her side, perfect. We're gonna pull out a leg. Sam's then gonna be able to hold off this leg to draw blood. She's still eating. And here we are here. In an interest of time, I'm not gonna draw blood right now, but at any point did she become overly stressed? I let go of that leg, she's gonna get up, we have heart blood, and she just had an awesome experience here at the vet. So that's a little touch on fear-free medicine. I hope to get more videos for you, puppy, kitten, senior pets. I like to practice, and I think we all should practice as if you're the patient. Always think of that, and I hope to see you next time.